My name is Petra. I am working as a lab technician and I did 2 missions with MSF. I'm not sure if there's sort of like a typical profile for a lab tech, but because it depends a lot on the project content. But I think in general one can say you're always involved in hospital laboratory activities, so it's usually always involved knowing something about hematology, microbiology, blood transfusion, and also parasitology. In Sierra Leone, the testing was a lot on malaria because the project was focused on malaria treatment, also mother and child care. So we had a huge sample size on malaria slides. We also do parasitology. We also do CSF, which is spinal fluid, to see if people have maybe a meningitis. But we also do a lot of rapid tests, immunological rapid tests, in terms of hepatitis, HIV, syphilis, for example. There are quite some differences between a job in a Western hospital lab, I would say, and in the field. And I think sometimes it can happen that you simply don't have any electricity, or it is not a reliable source for performing your tests, and which means you have to change from an electronic centrifuge to like a hand centrifuge. So it is possible, but you have to be able to improvise sometimes. And another difference, I would say, is also to recruit laboratory staff, which I did not do before, and also to supervise and train laboratory staff. Regarding training, like I myself organized a weekly training with my national colleagues, and it depends a lot how you organize your training. It depends a lot what kind of possibilities the national colleagues had before on getting trained on laboratory techniques and methods. So sometimes it really means that you have to start from the ground and to train or talk about very basic things. On the other hand, I also learned a lot from national colleagues in terms of tropical diseases, which I heard about in school, but never really did so much in practice. So I found it quite challenging to arrive in the field, being immediately in the role of a supervisor and working in a context which you're not familiar with yet, and also not really knowing the conditions very well yet, how people are working in. But you were having right away the responsibility, the final responsibility of all the lab results going out of the laboratory. But in the field, like a lot of things and all the tests and exams are taking place in the laboratory itself. That means you have a lot of patient contact, and you are the one who is taking the blood, like venous blood and also finger prick tests. And so it's sometimes very noisy and very lively in the laboratory, but on the other hand, I also enjoyed this very close contact with our beneficiaries. Yeah, what was a challenge I did not think before, actually, when you take venous blood from patients in, for example, African countries, in children, it can be very, very difficult to find the veins. And sometimes I also had to ask for some support in the beginning from my local colleagues, because they were way more used to that. I think one of the, it was a very big challenge to work on blood transfusion in general, because blood transfusion is like always, it's like an immediate life-saving thing to provide the blood people need. And it's not easy all the time to really get your donations, because there's a lot of, blood is very much connected to a lot of cultural issues, and for some people it's not just simply, it's not simple and easy to just give their blood away. And what was difficult there sometimes too is, of course, if you take blood from people, you have to test it before you use it for transfusion. You test it on hepatitis, you test it for HIV. And we sometimes had the case that we found positive results on hepatitis, for example, also HIV. and then what to do with these results in case there is not the possibility in our hospital setting to treat them for those diseases. I think a lot of times you have huge expectations from the medical team to the laboratory because they are sending their orders to the laboratory expecting to having a result as soon as possible, like they are also used to in a Western hospital setting. And I think this requires a lot of communication with the medical team to tell them that the laboratory here also has limitations, and sometimes tests just take way longer than they would take in a Western hospital lab. For example, a malaria slide to dry in a setting like Sierra Leone, which is extremely humid and hot, can take a very long time. It's also, for example, in a very humid and hot area like Sierra Leone, we had to face a lot of challenges in terms of storage conditions also. So we had fungus growing everywhere, and fungus on slides, fungus on the microscope. So this requires like special procedures to clean, but it can be pretty frustrating too, because you are asked to perform a very high quality diagnosis, and simply because of the conditions this can be difficult. For doing a good malaria staining, you need water with a specific pH, which is not a big deal at all in Western laboratories, because you can just buy it even with the right pH, and there you continuously have to check because you don't have water available just coming out of the font. So I learned a lot on how I still can deliver a good result, but with much more basic conditions. MSF is offering good trainings. There is one training in Vienna every year, and there's other trainings also in African countries and in other European countries. But what I also did is I went to hospital laboratories to sort of refresh my skills on blood transfusion, because I haven't been working in this area before much. Another recommendation, I think it is based on my own experience, it is good to invite people from the logistician team, from the medical team, or everyone who is interested, to let people know how laboratories actually function and what we are doing in there, because then it loses a little bit of this mysterious touch, and people also understand better what kind of limitations we are facing maybe sometimes. There's also something I was not so much prepared for, actually, when I went on my first mission, that I have to train also cleaning staff. I figured that out, that people were not so much aware how that they're dealing with infectious material and regarding waste management. So we also had some training sessions together with the logistic department to establish a good system to make this a safe and secure place. What you can expect is, if you're going to a mission, is you usually have a job description in your hands, and you should get ready that it's maybe not really matching up 100%. So have some room for creativity, flexibility. I think what one can expect also is like this really nice and enriching exchange with national colleagues, and it's really learning on both sides. I appreciate that a lot, and I learned incredibly much.